Gary Crowley here with step 1 of hip pain relief. And the first thing we're going to do is actually release all these big muscles in your hip on both sides, but basically from your tailbone all the way over to your hip bone. All this is basically just a whole bunch of big strong muscles. So if they're tight and they yank on your tailbone or yank on your hip bones, they can torque things out of position and you will feel pain. So the first thing we're going to do is a tennis ball release of your hips, and it is exactly what it sounds like. We're going to take a tennis ball and I'm going to have you sit probably in a reasonably firm but maybe chair with a little cushion just so the ball doesn't scoot around. But I'm going to have you put it under your butt, one of your butt cheeks, one of your hips, and I'm going to have you then put some body weight into it. And when you find a tender spot, like right there for me, too much driving this weekend for me, you're going to move that leg. So you're pressing on one spot and you're making that muscle move under that spot. And as that lets go, then we scoot up to another spot. And there's a good one right there, actually. And mostly moving your leg is going to get, it's probably the easiest way to get this going. And this lets go pretty well because I don't generally have hip issues. You might have to take your time to do this. If you do it on a bed, you might get a little baseball-sized ball. If it's a really cushioned bed, you can even use a softball, but this starts getting a little blunt. You really want the focused pressure that maybe a smaller ball, even a lacrosse ball on, I don't know, for some people I guess. It's probably a bit much for a lot of people. So you get your tennis ball in there, you do that on both sides, and you'll feel when it lets go. It lets go, and then we will now, after you do both sides, we move on to 2 hip stretches. One is what I call a reclined hip stretch, and basically you lie on your back with your leg crossed, one leg crossed over the other, the same arm as the leg that's crossed. You're going to grab this ankle and you're going to pull this ankle toward you while you shoot your body this way, and you're going to put this arm over your shin. So in one motion you kind of do that. And that just helps me get as far over that shin as I can so that then I can take this hand that was on my ankle, reach it through the hole in my legs, and grab my forearm. And now I have this nice, relaxed stretch where I can hang out here and talk to you for 20, 30, 40 seconds and do that. Do a few rounds of that, maybe do 2 or 3 of those. Then you switch to the other side again, same arm as the leg that's crossed, shoot over that shin, reach up, grab that forearm. You can see this hip's a little tighter on me than the other one. Do 2, 3 rounds here, switch back, go over, switch back, go over, and you'll feel all this tension let go over time. After you do a few rounds of that, you do the seated hip stretch, where you get both your legs at a 90-degree angle. And when you do this stretch, you never want to feel it in your knee. If you feel it in your knee, move your foot either up or closer to you. Find a spot where you don't feel it in your knee. But basically, you're going to lean over your shin from your knee to your foot. You might feel different things depending on where along the spectrum you are. But you do that, and you'll feel it in your butt, or you'll feel it here generally, sometimes even up into your low back. Then you switch, do the other side. And I'm tighter on this side again, so I could probably use more time on this one, but do a little bit of work here, switch back, do some work there, switch back, and basically over time, as you let one side go, it'll generally help the other side release as well. And lastly, an extra technique that you may or may not want to do, but for people with pain right on their hip bone, a lot of times it is on the outside of your hip bone. It's a muscle called your obturator internus. And that muscle goes from your hip bone and tucks all the way in around your sits bone. These are these bones in your butt that if you sit on a hard chair you generally feel. So that muscle comes out from there, comes out to here, and if it's tight, you will feel it at the attachment on the hip. So basically what you want to do is we're going to do the press, hold, move technique. But if you lie on your side, you feel that sits bone right there.
you come to the inside of that, and then you move your leg, you will feel that muscle that does that. And if it's tight, you'll know it, you'll feel it. And you just move your leg, feel around in there, move your leg until it releases. Probably want to check the other side, but that's an extra technique, but it's worth checking, especially if you have pain right there on the edge of your hip. So that is step 1 of hip pain relief. I will see you at step 2. Thank you.